All right. Well, good afternoon, everybody. I'm Peter Zanoni, City Manager for the City of Corpus Christi, and we're going to begin our joint Nueces County, City of Corpus Christi COVID-19 press briefing today. Today it will be myself and our Director of Health, Annette Rodriguez, that'll present. Our elected officials, Judge Barbara Canales and Mayor Joe McComb, will be here tomorrow. They're joining us on Tuesdays and Thursdays unless there's a special event going on, then they'll join us for those days as well. So today will be a pretty quick briefing. We appreciate people tuning in and watching us on Facebook and YouTube and news channels as well. This information is important. The more you all listening learn and understand and communicate with friends and colleagues, the better. We're doing a good job as a community using information and data to slow the spread of COVID-19, reduce infections, and reduce deaths. The number one goal for our health district and the city policy leaders and persons like myself is to keep people safe and reduce the number of deaths. And I think so far the community's done a great job in doing that. So today I'll do just three or so quick things, just an update on the statistics of how many persons have COVID and their status in terms of being in the hospital or not. We're going to do a quick update on our firefighters, a few firefighters that were put in quarantine earlier this morning. We'll explain why. And then I'll just do a quick reminder of the small business and the homeowner and renter assistance programs that we have out there. And then Annette is going to talk to us about the CPAP and BiPAP. Those are breathing machines that people have in their homes that they may not be using anymore, and they can be donated. There's a donation program. And she'll also talk about tomorrow's drive-through process. There's another drive-through scheduled for tomorrow. We had one on Monday, and we did just under 100 persons at the drive-through test on Monday, and there'll be another one tomorrow. We'll get an update on the number of persons that are pre-cleared to go through that drive-through. And that will conclude our briefing for today. Okay, so I will begin with the statistics, and every day at 4 o'clock we look at what's happened the past 24 hours to see if we've received new cases of persons that have been diagnosed with COVID, and we also look to see what is the medical condition of those persons that already have it. And so in the past 24 hours, there have been 0 additional persons diagnosed with COVID. Yesterday at this time we had 99 persons, and so today we still have 99 people that either have or have had COVID-19. You can see the trend graph here from the past 7 days. We're back to a couple of zeros. So we have 3 days with zeros, a couple of days with ones and 2, and we had that 5 number on Monday on 4/27. The number of deaths that we've been reporting now is 3 within Nueces County. And one of those persons was a resident of Robstown. One is a resident of Corpus Christi. The third person is a resident of Corpus Christi, but actually passed away in the state of Nevada. But because this is his hometown and he had a permanent residency here, a permanent home, he is counted as required by the CDC and state health agency. The number of cases in terms of 99 is 53% are male and 47% are female. And then we look at the age group. We have 9 categories that we can classify somebody that has had COVID or has it today. And they're about 10-year increments. The majority of persons are in the age of 20 years old to 79 years old. Those are split by 10 years, 20 to 30, 30 to 40, and so on. So in those 6 age groups from 20 to 79, it's pretty evenly distributed. And the message that we tell people every day is age is not a factor in whether or not you get the virus, and it can be picked up by anybody of any age. In fact, when I talk about the firefighters quarantine, they are quarantined because of helping a 1-year-old child, so that is suspected to have suspected to have COVID. So that's it on the age. And then the number of tests is something that's important to the community. We've been reporting every day. Our test numbers continue to go up, both from the city and our drive-through testing sites, and then the numbers that we get to analyze in our labs, as well as the number reported to us from the hospitals, physicians, and clinics. They refer their samples or their tests that they take from a patient to private labs, and we find out about the private lab's actual testing through the hospital, saying I'm sending it over to them for their analysis. So labs, commercial labs like LabCorp and Quest, the ones that perform the actual analysis, similar to what we do in our lab. So we today tested 4 additional specimens, and the private sector, the hospitals, clinics, and physicians sent to the commercial labs 149 specimens. So that's a total of 153 tests analyzed today. And in total, since we've been tracking this, we're at 2,441 tests performed in our county. Okay, let's look at the statistics. So that number 99 has, since we've been tracking this now, which has been about seven or 8 weeks or so. But one important thing to point out is that people are recovering, and the number of new cases is not growing as fast as it was initially. So when you look at this pie graph here, we have today, as of today, we have 43 persons that have now moved into the fully recovered state. That's an increase of 4 since yesterday. And so this part of this pie is getting bigger, and that's what we want. So about 43% of all the cases that we have of those 99 are recovered, which is good. That leaves us with that difference of 56 persons that still have COVID-19. Of those 56, only 1 person is in the hospital today. So yesterday there were 3, 2 have been discharged since yesterday. That 1 person that is in the hospital is in intensive care, and that's the status for the hospitalizations. There was, since we've been tracking this, a total of 21 persons either in or out of the hospital over time. Today, there's still just 1 in there. And then the final stat we report on is where do the folks live that had or have had COVID-19 in Nueces County, what city? And so the majority obviously live in the city of Corpus Christi, with the biggest city. There's 84 persons that were diagnosed with it in our city. Robstown had 2, Port Aransas has 7, and then the remainder, which is 6, are within rural Nueces County. They're not in any particular city. Okay, so that is the summary of the statistics. Did you want me to take a break? We'll do a quick Spanish translation, and then I'll just do 2 other quick updates for the community.
En las últimas 24 horas no se han reportado casos nuevos por el virus. Actualmente existen 99 casos en el condado de Nueces. A la fecha va un total de 2,441 pruebas realizadas entre el Distrito de Salud y laboratorios privados. 43 personas se han recuperado. Una se encuentra en el hospital en la unidad de cuidados intensivos y se han reportado a la fecha 3 fallecimientos. Las personas afectadas residen 84 en la ciudad de Corpus Christi, 2 en la ciudad de Robstown, 7 en Port Aransas y 6 en áreas rurales.
Okay. Okay, now we'd like to update the community. We have changed our protocols in our public safety first responders many weeks ago, but we still run into situations where a firefighter or police officer can be placed into a situation that requires them to be quarantined because of a potential COVID patient. And so earlier this morning, 4 firefighters responded to a call for service for a 1-year-old infant who was not breathing at the time they got there. They performed their basic life recovery services and ultimately transported the 1-year-old to the hospital. During the process of all of that, there was some maneuvering with the eye goggles of the firefighters so they can better see things like putting in a needle and doing CPR with medical devices. And so by adjusting their goggles, we felt that they may be in harm's way. That was determined after the fact that the child who got to the hospital was determined to be a candidate for COVID, some of the symptoms the child was showing. So the child is being tested, but in the abundance of caution, we've placed those 4 firefighters into quarantine earlier today. And once we find out the results of the 1-year-old's status as to whether or not he has COVID, we'll determine what to do with the firefighters. So except for those 4 firefighters, there are no other first responders in quarantine. Did you want to translate that one? Okay.
En resumen, 4 bomberos fueron puestos en cuarentena después de tratar y transportar a un bebé al hospital, quien luego se determinó que mostraba síntomas del coronavirus. Esta mañana el Departamento de Bomberos de Corpus Christi respondió a una llamada médica para un bebé que estaba inconsciente y no respiraba. El equipo de paramédicos llegó para encontrar a la madre practicando resucitación cardiopulmonar. Los bomberos cuando llegaron se quitaron las gafas para tener una mejor visibilidad mientras completaban los procedimientos durante el transporte al hospital. Por precaución, los 4 bomberos permanecerán en cuarentena en espera de los resultados de la prueba del coronavirus del paciente.
Okay, great. Okay, and then the last thing, just to remind the community about, is both the business community and the residential community, is the city and our city council has approved dollars, several million, to help small businesses recover, and also to help those that may be struggling to pay their rent or their mortgage or the utility bill. So if somebody out there is a small business owner, and that means that they generate 1.5 million or less annually in gross sales, then they're eligible to consider a no-interest loan through the city that has a 3-year payback and no payments for the first 4 months. We are contracting with an agency called LIFT Fund, L-I-F-T Fund Incorporated. We've had a 15-year relationship with the LIFT Fund. And so if anybody's interested in that loan to help them get through this economic downturn, they can contact LIFT. The number's on the screen here at 888-215-2373. They can also go to their website, liftfund.com. The entire application process is done online, and then there's other information as well there. This number is a Corpus Christi number. There's a local office here, and a person can be talked to from, I think it's 8:30 to 5:30. So if they miss that time frame, there's still information online that can be seen until the next day. The office hours are Monday through Friday. We have quite a few loans in the queue, but if you have your information, your business information in good order, you still have a chance, I think, to be funded. The loans range from $15,000 to $25,000. And then on the residential side, there's dollars available, a total of $1.6 million that City Council approved to help persons pay their rent, their mortgage, or the utility bill should they have lost income due to changes in the economy because of COVID-19. In this case, we're partnering with 2 agencies that we've had a longstanding relationship as well to administer similar programs. And a person, no matter if they're a renter or a homeowner, can call either agency. And so the 2 that are listed on the screen include Corpus Christi Hope House and then the Salvation Army. Anybody can call either of those 2 nonprofits. And so the Hope House number is 361-852-2273. And then the Salvation Army's number is 361-884-9497. And so feel free to call those 2. We have that $1.6 million in resources there. And as of earlier this week, there was a little bit of progress being made in terms of allocating it, but there's still availability. And we encourage you to use that money if you need it. That's what it's there for. And we want to thank City Council, the mayor, and the 8 council members for stepping up and making sure there was available resources both for small businesses as well as for our residential customers out there. So with that, we're going to have that translated, and then we'll have Annette Rodriguez come up and talk about some of the health matters for the community.
En cuanto a los préstamos para los pequeños negocios, si usted busca asistencia y obtener un préstamo, puede llenar una solicitud a la dirección www.liftfund.com o llamar al 1-888-215-2373. Recuerda llenar toda la documentación necesaria para poder así realizar el proceso más rápidamente. Si usted es residente y solicita asistencia para realizar el pago de su hipoteca, renta o servicios, puede obtenerlo llamando al Ejército de Salvación al número 884-9497 o llamando a la Casa Esperanza al 852-2273.
Good afternoon. Thank you. Annette Rodriguez, Health Director. So yesterday was the first day to drop off the sleep apnea machines. I'm very grateful to this community because they always step up, and they did the same. 56 BiPAP and CPAP machines were donated, so again, thank you. And also thank you to the Del Mar College team. They actually collected them and they sanitized all the machines. So the next days to drop off the sleep apnea machines is going to be tomorrow, April the 30th, as well as Friday, May the 1st. And it's going to be at the same place, Del Mar West Campus. That is not the main Del Mar campus. That is the West Campus at 4101 Old Brownsville Road. And it's going to be from 3 p.m. to 6 p.m. Since there are still 2 collection days remaining, I'm going to ask that whoever didn't get a chance to drop off those sleep apnea machines, that they consider donating them to our community. Although these machines are generally used by people who suffer from sleep apnea, they can also be used in emergency situations as an alternative for ventilation. I love it when the blood bank says after you donate blood, they say the life you saved could be your own. This is the same is true for these machines. Tomorrow is the next drive-through at 8 a.m. at the Old Memorial parking lot. We expect to have around 130 individuals come through to be swabbed. Please remember that the drive-through is by appointment only. We also ask 2 things of you, that you drive slowly, and our healthcare workers really do not want you to take pictures of them. They really feel like you really need to be concentrating on the driving and not taking their pictures. So, as more people are integrated back into our community, I think it's also important to say that wearing a mask is highly recommended and very, very important. And make sure that we use it correctly. So I wanted to give some do's and don'ts, as you'll see here on the board. So for the do make sure that you can breathe through it. So don't make it so constrictive that you can't even breathe. Do wear it whenever you're going out into public, especially if you can't social distance yourself. You make sure that you wear a mask to protect others from getting sick. Do make sure that it covers your nose and mouth. I have seen people that are wearing it underneath their nose, and it really needs to cover both your nose and your mouth. And do wash it after use. For the don'ts, it's don't use on children under age 2. I don't know if any of y'all have ever had a child age 2. They call it terrible twos for a reason. They will not keep it on. They will toss it off. So don't use it on children under 2. Don't use it on young children if they're sleeping, like in the car seat when you're driving. Don't use it on them. Don't use medical-grade surgical masks or other personal protective equipment intended for healthcare workers. We really need to make sure that we have that available to them because they're in situations that they need that type of protection. And again, continue to stay safe and stay healthy and stay informed. Thank you.
Ayer fue el primer día en que se aceptó la donación de máquinas para tratar el apnea del sueño. Gracias a la comunidad por donar 56 máquinas CPAP y BiPAP y una variedad de accesorios. Los próximos días para aceptar donaciones son mañana 30 de abril y viernes 1 de mayo en el campus oeste del Colegio de Elmar, ubicado en el 4101 de Old Brownsville Road, de 3 a 6 de la tarde. Mañana es el próximo día de tomas de especímenes para detectar el coronavirus. Esperamos contar con más de 130 personas. Recuerde que solo se aceptan a personas con cita previa. Le pedimos tomar sus precauciones al momento de estar formado. En especial le pedimos que no tome fotografías y conduzca al mismo tiempo. Así evitaremos tener accidentes. Le seguimos sugiriendo el uso de tapabocas cuando se encuentre en público. Asegúrese de poder respirar cómodamente. Cubra su nariz y boca y lávelo después de usarlo. No lo utilice en niños menores de 2 años y si niños pequeños están durmiendo, tampoco los utilice. Las máscaras quirúrgicas de grado médico, estas son solamente destinadas a trabajadores de la salud.
Okay, great. Just one point of update, and then I'll just do some closing comments, and we'll see if there's any questions. So, since I stated the issue of 4 firefighters, Chief Rocha, our fire chief, has informed me that one of the firefighters, upon further review, was not in any harm's way, so to speak, with the potential COVID-19 infant or 1-year-old. And so he is not in quarantine. So that just leaves 3 firefighters then that are in isolation or quarantine. So just 3 firefighters. And we'll, as we await the results from that infant test, we'll keep them in that situation to keep them safe and their colleagues safe. Okay, so tomorrow is Thursday, and that's the day that our elected officials join us here at the press event as well. So tomorrow, we can expect to see Nueces County Judge Barbara Canales. She'll be here tomorrow. And then City of Corpus Christi Mayor Joe McComb will join Annette Rodriguez and myself. That'll be Thursday. And then Friday, Annette and I will be back. But also Friday, Texas A&M Corpus Christi, our team from there, that's been helping us. This will be their 4th presentation, and they've been great and helping us with modeling and predictability, showing us the results of how as a community, by social distancing and staying at home, it has mattered. And they're updating their models. They're gonna show us that cell phone data tracking chart again that shows how we've been doing in terms of either staying away from others or not. And they'll also model what the implications are from their perspective using the models of number of cases that could become apparent as we reopen Texas and Corpus Christi. And that'll be Friday, and that'll be it. And then we'll be here over the weekend in terms of data. There's no press event over the weekend, but we'll have updates on Saturday and Sunday in the statistics as we have had for the past 7 or 8 weeks or so. So we're going to get that translated, and then we'll see if there's any questions from the folks that are here today.
En información más reciente, son solo 3 los bomberos paramédicos que están bajo cuarentena, ya que uno de ellos no estuvo en contacto directo con el paciente. El viernes tendremos otra presentación por parte del equipo de la Universidad Texas A&M y un modelo nuevo de rastreo móvil.
Okay, great. Any questions? From Courtney, maybe?
Are there any plans in place or in development to begin any?
Yeah, let's have Annette talk about that.
So the question was, are there any plans in place to start antibody testing? Yes. So we don't have any plans at the health district to start antibody testing. We did get the ID Now, the Abbott ID Now kits, and we've gone through some validity with them to try to get them validated, if you will, but we have not gotten to where they need to be. So the highest we got was 75% validated, and so we're not there. But for the antibody test, as far as the health district, we don't have any plans to get that.
What is the status of you said you had low test kits yesterday?
The test kits? So we got an additional 90 today, and so we were at 135, and so now we're plus 90, 225. So we're good. Thank you.
Okay, I think that's it for questions for today. So thank you all for being here, and thank you for those that are watching out there. And keep it up. Tomorrow's Thursday. Friday is when the governor's new orders come into effect. So we still need to obey the prior orders of stay at home and those closures. So have a good evening. We'll see you tomorrow. Thank you.